Now, the Limpopo Health MEC, Dr. Phophi Ramathuba, will this morning monitor COVID-19 vaccination rollout for the Correctional Services staff as part of stepping up the fight against COVID-19 in the province. SABC News reporter Lutendo Bobodi joins us now live. A very good morning to you, Lutendo. Thank you so much for joining us. How is the turnout so far?
Thank you so much, Simpiwa. It's bright and cloudless morning here in Seshego, just outside Polokwane. As you can see, the vaccination process has started. Here it's basically or essentially focused on on different sectors, your SAPS, of course your Correctional Services employees, also NPA. As you can see behind me here, Correctional Services officials here are ready to take their jab. It's not just them, it's a long winding queue of different people, also teachers, those who can call the last remnants, who are of course taking their jab here today. These are, as you can always see, it's quite naturally, these are long queues. I don't think you've ever seen any short vaccination queue anywhere around South Africa. And the work of the health officials is cut out for them. They're rolling up their sleeves and they're ready to vaccinate these people. Like I said, it's an assortment of groups from different sectors, also including the social development people who are also here getting, of course, different types of the jab, the Pfizer and also the J&J. But to talk more about that, I'm joined by MEC for Health in this province, Dr. Phophi Ramathuba. Dr. MEC, thank you so much for your time. We very much appreciate it. Talk to us about the process here today.
You would remember when we started vaccinating the educators, we declare Friday as our workers' vaccination special day, wherein we focus on each and every sector. Today, you have got the remains of the support staff for education, the one that were not on our system, the one that we could not find on the list of education, and also EVDS. So the education has been able to submit this list. While they are not registered on EVDS, we want to rely on what education department is saying. These are their food handlers, their cleaners. We've already done with educators. So this, the few that are remaining, we are just mopping them up. And then today, again, we are launching the vaccination for Correctional Services staff, the personnel. We have got a total number, I think, of around 1,189 that are registered on EVDS in the entire province. The remaining, because their staff component is 1,300 plus, the remaining there is 100 plus who are skeptical, which we still need to continue with our message on the vaccination. But today in the province, because they work in terms of the shifts, we have 455 across the province. When you see in this particular station 200, we have already vaccinated all these ones that you see standing here. They've already been vaccinated, and we are left with a few educators support, because by 11 usually or 12 o'clock, this station we are already done with all those that need to be vaccinated.
I think lastly, just talk to us about the CC in the province.
Yes, there is a spike. We must indicate that we are still battling with Waterberg as a district to contain. Lephalale continue to be a challenge for us. Out of the 1,400 cases that were registered in the past 24 hours, you would see that Lephalale it's contributing and Waterberg around 400 compared to all the other districts. When you go to other districts, the situation is not as bad as you see in Lephalale, except if you come to here in Polokwane, which we expect Polokwane to be high, to be having over 300 cases. But then our other worrying municipality was Makhado municipality, which when we zoom in last week to try to find out what could have been the cause, it was attributed to a number of funerals that are being held in that particular municipality. To say funeral in their own nature, it's an area where it becomes vulnerable, even if you are 50 at the funeral. the fact that there are emotions, the fact that we are crying, the fact that we are supporting each other, it makes us to be vulnerable to say just one person being infected, you then all get infected. And also the Delta variant has played a major role in seeing this spike that is continuing. But if you look at municipalities like Mopani, we see their numbers are still there. There's a in Mopani district, there's a Mopani municipality called Greater Lutabo. In that municipality, we continue to register numbers that are even less than 10 up until today. So we think that even other municipalities, if we can continue to work with our local command council, we can be able to contain. That is why you see us pushing hard so that the security cluster get vaccinated. Your police must be vaccinated so that they can assist you, boost their morale. They will be able to go with us and make sure that compliance in terms of COVID-19 regulations it's adhered to.
Thank you so much, MEC. Thank you so much, Simpua. That was MEC for Health, Dr. Phophi Ramathuba, who was telling us about the vaccination process here and how smoothly the whole process is going. She also touched on the issue of the spike in the cases of COVID-19 in the province, of course, touching on the issue of funerals as super spreaders, which is true. I don't know how many people I know who've been affected at the funeral, and some of them even went on to die, simply.
Lutendo, as much as the Correctional Services staff will be vaccinated, any word on whether the inmates themselves will be vaccinated?
Yeah, thank you so much. No, there isn't. I think right now the focus, of course, is the officials themselves, and which are in the province, in this province, Limpopo. It's just many of them. I mean, they said Limpopo has one of the biggest pools of labor in terms of correctional facilities, because we have some of the biggest prisons or correctional facilities in the province. We're talking about your Makado and your Lutendo Correctional Services. These are massive, and you have a lot of a big labor pool. Of course, the ratio is still, just a few of them against hundreds and hundreds of prisoners or inmates. As you know, the issue of overcrowding in our correctional services. But of course, it's still the pool is still massive. There's a whole lot of correctional service employees and also police officers, of course, NPA people. But the inmates themselves, they are 10 will come in due course, simply.
All right, Lutendo, thank you so much for your update. We do appreciate your time. That was a reporter, Lutendo Bobodi, speaking to us live from Limpopo, wherein the Health MEC in that province, Dr. Phophi Ramathuba, is monitoring the COVID-19 vaccination drive of Correctional Services staff.